great. And I'd like to welcome you to the Drug Endangered Children and Creating Community Alliances session. Few reminders before we get going. This session will be recorded and will be available on the conference platform 1 hour after the session ends. Please keep yourself muted unless the presenter asks otherwise. Make sure to join sessions live today because we'll be doing a prize drawing from attendance within each session. And the conference is also offering free continuing education credits. And if you need more information on that, you can check out the continuing ed page. So today for our presenters, we have Jennifer Gasman and Mike Parsons, and I'm going to turn it over to them so they can get started.
Great, thank you very much, Nancy. Just to start off, my name is Jennifer Gasman. I am with Kansas Children's Service League, and I supervise our parent-child assistance program, which we'll talk about more during the session, but work specifically with parents with substance abuse issues. I've also been in. Sorry. Someone's not on mute. I've also been involved with our drug endangered children efforts in Shawnee County since 2005, and I'm also the chair of the board of the Kansas Alliance for Drug Endangered Children. So I'll let Mike introduce himself.
Good afternoon, everyone. My name is Mike Parsons. I work for an agency, DECA, and I am a prevention program coordinator. And we do our program, part of DECA, we do prevention services or provide them across the state. So we've got community support specialists stationed throughout the state, and we do prevention efforts within those communities and work with those coalitions. So I'm also on the board of directors for the Kansas Drug Endangered Children Alliance, and I've been involved with DEC now, not as long as Jennifer, but I'm coming up on about 3 years now that I've been involved with National DEC and the state DEC program. So I'm glad to have everybody here today. Thanks.
Yes, thank you. All right, let me just get our PowerPoint up and screen shared. Okay. All right, we'll just start off with the most basic part of drug endangered children, and that is our definition. The official definition of drug endangered child is a child found in an environment where illegal drugs are manufactured, sold, distributed, used, or where there is other significant evidence of illegal drugs. We also use the term children to include specifically babies who are exposed to illicit substances during gestation and are born with these substances in their systems. So just to talk about some numbers in Kansas, we have up to 167,807 Kansas children live in an environment where substances are abused. So they're in a home and parent or caregivers using substances in that home. And then approximately 3,989 Kansas infants are born substance exposed every year. Obviously, these are estimates. There's no real way to get exact numbers of this. So with infants, a lot of people ask, how do we test infants? A lot of people think every baby is tested for substances at birth. Again, this is an estimate because many babies are not tested. That policy can vary from hospital to hospital, area to area. Here in Topeka, the hospitals test babies based on criteria. There's any known history of substance, if there were prenatal care, or if there were complications at birth, placental abruption, or premature delivery. So if none of those things are known, then that baby might very well have been exposed throughout the pregnancy, but we won't know about it because they won't be tested. Just some headlines about drug endangered children in our area. So in Missouri, 2- and 3-year-olds were caught in crossfire of a drug deal gone wrong. Olathe, first responders have to use Narcan to save 3 children after their mother gives them an overdose of opiates. Kansas City, a couple are arrested after their 4 children test positive for meth. And in Kentucky, a Kansas man was accused of trying to buy an 11-year-old for $250 and meth. So some sad headlines. Here's a little short video about 2 very high profile cases that happened in Kansas. And I think many of you will remember these cases or have heard about them. I do sometimes get comments on the sound. There is no speaking on this video. There's some music playing, but it's very soft. So sometimes people kind of comment that they can't hear the video, but it's just reading the video. So.
What are you listening to?
So as I said, those are two very high profile cases that happen in Kansas. And, this is not to single out any one agency or person who failed these children, but these children fell through the cracks, and that's part of our work with the Drug Endangered Children Alliance. But these children were drug endangered children to start with, and they fell through lots of cracks in the system and ended up paying with their lives. And so the work of the Drug Endangered Children Alliances is to have services in place, have protections in place so that things like that do not happen. And so that leads us to our slogan, which is drugs plus children equals risk. Just some more statistics about Kansas. Approximately 65% of individuals entering state-funded treatment had children under the age of 18 in the household. And of course, we know many of those parents never seek out treatment. So this is not covering all children who have a parent with substance use issues, but that is a very large number of the people who are entering treatment in the state of Kansas that have children. In Kansas, 12% of Kansas children that have been removed from the home and placed in DCF custody had parental substance use as the primary reason for removal. That does not tell all of the cases that have substance use as a contributing factor to removal, because they identify cases for the primary reason for removal. So a child might be removed, a 3-year-old might be wandering in the street and, at night alone, and gets placed into DCF custody because of that. So the primary reason would be lack of supervision. However, what may be behind that lack of supervision was that parent was passed out due to substance abuse, but it's only going to be listed as lack of supervision, not parental substance use, even if that was a main reason. So that 12% is just the primary reason for removal. Just some other numbers to show the compare between Kansas and national. So the orange line on the graph, Kansas, the blue line is national. So this shows the prevalence of parental alcohol or drug abuse as an identified concern, reason for removal from 2019. So as you can see, when it starts out in 2000, we are below the national average. When these statistics end in 2019, we're above the national average for children being removed due to substance use. This just breaks it down by age. So under the age of 1, over the age of 1. So again, this is the same. We have more children under the age of 1 getting removed due to parental substance use as opposed to the national average. And in Kansas, we have more children under the age of 1 that get removed to substance use as opposed to older children. And so the reason for that is, fairly obvious. Babies get born and test positive for substances. They're seeing the doctors more. It's just they're more readily identified under the age of 1 if there's parental substance use issues. This shows the percent of children with terminated parental due to condition of removal. So nationally, 43% of parents with alcohol or drug abuse for reasons of removal ended up with parental rights terminated. In Kansas, we were above that number with 51% of children whose parents were ultimately terminated due to their substance use. And this just shows by state throughout the country, parental alcohol and drug abuse as an identified condition of removal. So Kansas is the line. So somewhat we are closer to the higher end of that number than most other states. And just some numbers for Shawnee County, since that's where we are from. Children placed in foster care in Shawnee County, 41.5% of children removed were due to substance use disorder. So it's very significant in our county. And then permanency goals for children in out-of-home care in Shawnee County. The dark blue line is due to substance use disorder removals. The light blue line is just for non-substance use disorder. So you can see that the top line is reunification. Fewer children were reunified if the parents had substance use disorder, and more children ended up being adopted or in permanent custodianship if the parent had substance use disorder. And the reason for that is just quite often recovery timelines do not mesh well with child welfare timelines. We have timelines for the courts to establish permanent children for a very good reason, but recovery timelines just do not end up meshing very well. If there's a relapse or a setback, it's back to square one and you're starting from the beginning. So that is why we often see more children ending up in other permanency situations rather than reunifying with their parents. Here's just a number. This is from Dr. Dennis Embry at the Paxos Institute. The cost of a substance exposed child. You can see pre-birth, $58,000, early childhood years, $34,000, elementary school years, $35,000. And numbers at that age would be hospital stays for, a baby that's born, infant toddler services for kids who might show delays, IEPs in school, mental health services as they get older and show more signs of ADHD or things like that. And then the numbers jump way up when we go to secondary and teen years and adult years. That's the point where they might be entering the court systems themselves, criminal cases, having substance use disorder issues of their own, or mental health services, physical health issues. But the total cost, they have figured, is $1,536,100, which is a shockingly high number, and which leads us to the obvious conclusion that prevention efforts are priceless if we can prevent any of these numbers for a child. Right, and I will turn it over to Mike now to talk about some of the effects of parental substance use on children.
Thanks, Jennifer. As Jennifer mentioned earlier, one of the main focuses of DEC, or Drug Endangered Children Alliance, is to change the path or the trajectory of the child and their siblings or the family themselves. So one of those things that come up is, well, I don't work with children, or I don't deal with children until they're teenagers, or I don't work with children, directly. How can I get involved? One of the things that we look at is starting with the source, or where this can be one of the most high risk areas that we look at, and it's possible effects of substance abuse during pregnancy. So folks that are parents that use drugs, or mothers that use drugs before the child is born, the prenatal exposure is about 30.2%. Are more likely to be reported as abused or neglected. Some of the effects of the substance use during pregnancy are here on the screen, such as low birth weight, sensory problems, sleep disturbances, sensitive to stimuli, depression, anxiety, increased of SIDS, developing delays, learning problems. If you look at this, if we could stop a lot of this or try to curtail it at the source, then some of those costs that Jennifer just talked about could be greatly reduced, and we would have many less children that would be in danger of drug, or be listed as drug endangered children. So then I think the next slide, I kind of jumped ahead of myself, but we talked about the risk of abuse, and this is where infants exposed to drugs in utero are more likely to be reported as abused or neglected, is at 30.2%. So like I just mentioned, if you work with these mothers or parents or families or adults that have substance use disorders, and or you feel, or there's reports that there may be young ones in the home, or even if there's the mother is possibly with child, is if we can get involved at an early age, or before the child's born, we'll have a better chance of changing the trajectory of these children. Just some risks of children that whose parents abuse alcohol and other drugs. Parental behavior under the influence. A lot of you would already be aware of this, but there's poor judgment, confusion, a lot of irritability, paranoia, violence. But one of the biggest things that we come across is the inconsistent parenting. Now, a lot of times people say, yeah, when they're under the influence, they can be very inconsistent as far as wanting to do this, or they want this to happen. But we also need to remember when these folks with substance abuse, when they don't have their their drug of choice or the alcohol that they need, that also leads into different types of behavior, because we run into a lot of situations that we're going to talk about here in a little bit, where the parents will do about anything in order to get that drug or that alcohol or whatever they need that their body's currently addicted to or that they're abusing in order to quote make themselves feel normal, is what they would say. A lot of this is, also is caused by inadequate supervision. These are some other things to look at when you're in the home as far as chaotic home life. There could be accidental ingestion of drugs. There's a lot of exposure to secondhand smoke, exposures to needles, exposures to other paraphernalia. One thing too is that there's even a higher risk of those children that are in what we call like a manufacturing type situation, where they may be producing the meth at the home, or they may be going ahead and using or smoking an abundance of methamphetamine, or they may also be using a lot of marijuana, but just different things where this drug use is a little bit more prevalent in the home at a higher degree than it would be if these children are in or out of different homes, or are being going over to like grandparents' house and things like that. So you need to really take into consideration the children that are in these what we call manufacturing type situations. The other thing is you've got exposure to violence, risk of abuse. We talked about that a little bit. Chronic neglect, lack of medical care, dental care, immunizations. They may lack food, running water, and utilities. A lot of this is due to the secret, and they don't want the secret to be known. So one way for their secret not to be known is to not let these children or take these children or make them possibly be exposed in any way. So if you don't want somebody to know, then one of the last things they would do is go ahead and take them for dental care, medical care, things like that. But also their priorities are not such that they want to take care of that child, when any type of money, funding, or availability to other things would be used to get the substances that they need. Parents who abuse substances, there are children whose parents use or abuse or have substance use disorders, are 2.7 times more likely to be physically abused, 4.2 times more likely to be neglected. They're significantly more likely to be abused by others. A lot of times these are the folks, quote, friends or partners of those that they use with. And we'll talk about this a little bit further, but it's a lot of the situations we come across that we're hearing more and more about is human trafficking, where these parents are trading their children for drugs. They're trading their children for sexual activity for drugs. They're offering all types of different types of abuse or situations that these children can be put in order in exchange for the substances that they're needing. Child maltreatment, it's leading cause of trauma-related death for children under 5, and about 66% occurs at the hands of parents under the influence of drugs or alcohol. So you can see that that's quite a high percentage of children that are being exposed. These are just a couple pictures that have been taken from the DEA and in other situations during, they're not necessarily raids, but they can be investigations. They can be child, Department of Children and Family pictures, just different things that have come across that we found that we wanted to share with you real quick. A lot of times you'll see, if you look at this looks like a child's drawer with children's clothing in it. A lot of times the parents will hide their substances. You can see there, it looks like there's one empty syringe and one full syringe. I'm not sure what that is in there. I mean, it very easily could be heroin, but they don't think that those areas are going to be searched, because they would think that no parent would go ahead and hide their drugs in their children's clothing or in their drawers or things like that. Also to the left of that real quick looks like someone pointed out to us the other day, that looks like a bottle of one of those containers or those blue velvet things that a bottle of Crown Royal comes in. Never really looked at that in detail, but that does look like something that would contain like a bottle of alcohol or things like that. The next picture is just more of a substance that's out. It looks like it's there on top of a mirror, piece of glass, something that's going to be, possibly snorted, continue to be cut, possibly injected. We don't know, but you can see there that it's on top of a television, which would give you, not only is it out in the open for a child to access, but it also gives you the sense that the top of the television could be reached by a child, therefore putting them in danger with the substances just setting out in wide open space for them to have access to it. The next picture, I believe, is the one with the, yes, has the children's toys. And not only does it have the children's toys, but right there in the middle is a weapon. One thing, if you look off to the left of this picture, not only is there a weapon next to the children's toys, but just to the left of that, you can see kind of what reads to be the end of the word syringes. And also you can read a little bit where it says that seems to say the word insulin and also part of the word of needle. So right there, you've got paraphernalia, weapons, and children's toys all together in one area, which definitely puts these children at risk. And a lot of these children are faced with this every day. They think it's normal. They don't pay much attention to it, but you can see where this is really putting these kids in danger, not only themselves, but their siblings and also the parents or anyone else that may be in the home. This, I think, is the last picture that we've got to show you at this time, but this is an actual housing or living unit where the children were discovered living in. And you can see it's a very chaotic, I would say, mess, very dangerous. Hard to believe that there would be children or even any adults living there. You can see anything from, it looks like prescription bottles there on the floor near the red Solo cups to a lot of electrical things. You look at the space heater next to the makeshift curtain with a door setting up against it, the exposed box springs over there to the left. Many, many things in this picture can be identified as dangerous to a child. But yet these are the living conditions that some of these children are found to be in when the situations are being investigated. So just wanted to point out a couple of the things to kind of give you a better picture of what we're talking about when we talk about drug endangered children. Now you need to be careful with these because this does not mean 100% that a parent or an adult that's taking care of a child is abusing substances. But when we look at these different things, and from what we've heard from children that have been raised in drug endangered children homes, is they report that they wish somebody would just have asked and said, is there something going on? Is there a way we can help you? Is there something we need to be aware about? And they said if they would have gone ahead and been asked that by someone in one of our positions that work with them or that provide some sort of care or safety for them, that they would have reported it. One thing that they said around their parents was it was not as obvious to them when they were using all the time, but for other adults, if you run into parents where their pupils are dilated or pinpoint a lot of times it's the odor, impaired coordination, erratic behavior, changes in speech such as slurred or rambling, and then lack of focus and concentration. These can all be indicators of substance usage. Like I said, it doesn't mean it's 100% causing that, but we just wanted to point out some of the things that indicate that something to be aware of, I guess would be the best way to put it, especially if you're in a home where you see are similar to some of those pictures that we had just shown you earlier. That those children are being raised in. So the next slide. These are just some signs within a home. There's two different lists here. Signs that children may be living in a drug endangered environment. As far as looking at the child themselves, and I don't want to say in a normal or average drug home, but they may be malnourished. Sometimes they may be obese, and people say, well, how can they be malnourished and obese? Well, a lot of it is just the type of foods, the healthy foods, the non-healthy foods that they're eating. A lot of times the obesity can come from these children that are being fed or living off of, fast food only. So whenever they do get food, it may be just fast food such as hamburgers, French fries, different things that are easy for the child to get a hold of, through different means. Also, the food that may be in the home, maybe pizza, maybe just something easy, something simple if they have it at all. But more on there's also poor hygiene, dental health. Children are often secretive or defensive about their home. They can be sleep deprived, delayed speech language skills, absence from school is a big one, violent behavior and lack of boundaries. So those are all things that can be signs. This does not mean that they are in a drug endangered home, but could be signs of that. More specific to manufacturing, like I talked earlier, their clothes and hair smell like chemicals. There can be chemical burns on the children, a lot of repetitive respiratory ailments, and a lot of knowledge regarding meth and the cooking process. Not only that, we've had stories and situations reported and pictures shown to us through a lot of our education where these kids will draw pictures of activity going on in their home that would represent drug use, or they may draw pictures of paraphernalia or things like that that their mom and dad or the parent that's taking care of them uses for their substance use. A lot of that's been turned into schools, and without education from the teachers or those that are working with these kids, if they don't know what these pictures could possibly be, then they're not aware. And so that's one thing as far as a Drug Endangered Children Alliance or environment that we're trying to educate and get out there the best we can, knowledge about these different behaviors that could lead to us being able to protect these children. Just a real quick on the home environment checklist. I won't go over all these with you, but the residence is cluttered, as you saw in the picture. They do feces in the home, not only human feces, but also animal feces. If they happen to have pets or animals, or not necessarily a pet, there could be other types of rodents or animals living in the home also. A lot of times these homes will not have running water or proper utilities, so you may find buckets of feces, urine, different things that they use to use as like a restroom. You've got a lot of paraphernalia accessible to children, prescription medication, weapons. There can be a lot of untreated medical issues. Children are dirty. A lot of children's bedding is soiled or dirty, or there's no bedding at all, and there may not be even a bed. So it just depends at the level of the abuse and the neglect that's going on in the home. And I think we're going to jump over to some ACEs here, I believe. Oh, no, a couple more pictures of paraphernalia. Sorry about that. These are just some things that are out that people are using and that can be very enticing to children. These are what we call glass pipes, which could be used for various types of drugs. So they look like toys possibly to children. They're very kind of colorful, have interesting shapes. But not only are they, quote, dangerous to just be glass, but also the substances that are used inside these pipes. And so this would be an example of something that a child may draw on a piece of paper, and it may be confused as, quote, a lollipop. But at the same time, somebody could look at that and say, well, there's enough other signs and symptoms going on here. Is this some sort of drug paraphernalia that this child is aware about? The next one is just about some dangers in the packaging and the marketing. These are marijuana candy bars, but you can see not only do they look like candy bars, they're labeled such as Butter Crunch, very enticing to a child, especially if that child is hungry. And a lot of times these children don't care what the label says. It looks like candy, so they're going to eat it, which makes it very dangerous for the children. These are marijuana suckers. Once again, they look like candy, very, very appetizing and very attractive to children. That you really don't know how much, quote, level of marijuana or THC is in these lollipops or these suckers, but either way, it's a danger for these children to get a hold of these and be using these in the home. And then there's also these marijuana drinks, which are packaged they look just like soda or pop bottles, or different types of flavored drinks that are in there. But these are actual marijuana drinks that are available. And once again, they look like something a child could look at and say, you know, this is something I want, something I need, you know, partake in drinking it. So they can be very dangerous again to these children. Just a few examples of things that are out there that make it challenging for us. I'm going to turn it back over to Jennifer. She's going to talk a little bit about adverse childhood experiences.
Okay. Right. It's really important that we talk about adverse childhood experiences when we talk about drug endangered children and parents or caregivers who are using substance use. So we'll kind of go over these quickly. Hopefully most of you on here are familiar with it. When we first started talking about ACEs, you know, a few years ago, a lot of people did not know about it, but we've had so much education and so much work on that in the state of Kansas that nowadays most people do. So, but when we talk about adverse childhood experiences, there are 10 things we look at: recurrent physical abuse, recurrent verbal abuse, recurrent emotional abuse, sexual abuse, alcohol and or drug abuser in the household. Oops. Oh, okay, an incarcerated household member, someone who is chronically depressed, mentally ill, institutionalized, or suicidal, where a parent is treated violently by another parent or person in the household, one parents, or emotional or physical neglect. So some of the findings that have come about from studying adverse childhood experiences are that they are surprisingly common, although typically concealed and unrecognized. Somebody may not think that much about what happened to them as a child and how that affects them as an adult. That all of these ACEs are highly interrelated with each other. And what we've seen is that they still have a profound effect 50 years later that are transformed from those experiences into disease, social malfunction, and mental illness. So when these things happen to you as a kid, then as we see, as an adult, people are more likely to have issues with physical health, mental health, addiction, you know, inability to keep a steady employment, things like that. So the main finding is that ACEs are the main determinant of the health and social well-being of the nation. So we've seen that ACEs have a strong influence on health, mental health, victimization, that, you know, having the same things happen to you as an adult is what happened to you as a kid if you haven't addressed those things and dealt with them. Stability.
Looks like you're stuck a little bit, Jennifer.
Jennifer, I don't know if you can hear us or not, but it appears you're frozen or you're having some internet problems. So I think I will. Oh, you're back.
Sorry, what was that, Mike?
You were frozen there for a little bit, so we lost you.
Oh, I was? Okay, sorry. What was I talking about?
You were going through some of these bullet points here and you froze.
Okay. So I'm not sure where I froze. Sorry about that. It looked all red on my end, but yeah, these are some of the effects that we see, and just the recommendations that we have seen from the ACE study is that an integrated approach to intervene early with children that are growing up being abused, neglected, witnessing domestic violence, or with substance abusing, mentally ill or criminal household members is extremely important. So to talk about why is prevention critical, you know, I mentioned earlier on that slide when we were looking at the cost of a drug exposed child, and prevention is priceless. So what we've seen is that prevention breaks the intergenerational cycle of substance abuse and child abuse by increasing protective factors and reducing risk factors. So we see that a lot with parents who are using substances, that they are in a way repeating what happened to them as a child. Many of the parents that we have worked with, their first use was in their home as a child, whether it's their parents giving them the substance, whether it was just there and they did it. But a lot of this starts as a child, and that's how they were raised. So without intervention or, you know, help in overcoming that, they will often just repeat the same cycles. And so we really want to break that cycle with their children. It conserves resources, which can be focused in other areas. Every $1 spent on prevention saves society $10. The value of prevention is often not seen when, by the government or the people who are making these decisions, but we know it does save money. It is effective in the long run. And then the ultimate risk of not having prevention is that adverse childhood experiences can lead to early death for people. So it's just important for all of us to understand that you may be the only intervention source for children affected by parental substance abuse. Everyone kind of thinks, well, that somebody else has probably seen that child, somebody else might know about it, somebody else may have made that report, but we can never assume that. It's just important to know that, we might be the only ones realizing what's going on with that child. We might be even if other people realize, we may be the only ones who are calling anybody's attention to that or making that report. So that's just very important for us to understand. These are just some considerations in working with families with substance abuse. Are the children safe? We said drugs plus children equals risk, but risk is different than safety. So our paramount consideration needs to be, is the child safe? What services is the family receiving? What additional services are needed? Are they in treatment? Whatever services. Is the parent continuing to use substances? And if so, can you effectively provide services? Are they making efforts? Are they under the influence all the time and doesn't seem to be making an effect? So with that, knowing how use is detected, are they taking drug tests for anybody, whether your agency or somebody else? And how can we know about that? Have effects of parental substance use on the child been identified? So, if the child might have developmental delays, we talked about all those things. Are they in services for that, or is that needed? And then what other issues are present? So it's generally not just substance abuse, it's mental illness, it's domestic violence, it's poverty, it's housing issues, school issues with the kids. There are lots of things that might be going on with the family, and it's important to know, to be able to look at all of those issues. And then just, for an agency, do the employees have training and resources needed to serve families? And if not, what's the plan for that? Obviously looking at staff safety, and then does your community have the resources needed? So just some other key factors in working with substance abusing parents. The most important thing, in my view, being non-judgmental. There's a lot of stigma with substance use. I think that certainly it's gotten better over the years. I think there's more understanding of substance use than there used to be, but there's still a great deal of stigma, and especially with parents using substances or pregnant women using substances. They feel very judged, and they are going to shut down if they feel like you're judging them. And then patience is also very important. Occasionally apparently a person can go to treatment and that's that, and they're clean for the rest of their lives, but that is the rarity. So the first time is usually not the end. There will be ups and downs and slides back and forward. And so it's important to stick with them through all of that. Remember, the majority of substance using adults have experienced trauma. So our program, our clients do complete the ACE survey when they start the program. And what we've seen is that on average, they have an average of 5 to 6 ACEs, which is a lot of trauma that they've been through. And also to understand that they are often lacking any positive support systems. Lots of times, everybody in their family uses, all the friends they know use. So to try to really make that commitment to recovery means giving up everybody that you know. And so it's really important to help them find other support systems, and they need somebody to believe in them and not give up on them. It's important to partner with the parent. Everybody tells them what they need to do, but to talk with them about what are their goals, what are things that they want to accomplish. And as I mentioned, just, there's often lots of issues going on with the family. So a wraparound approach is very important. If they just go to treatment, but they come back and they don't have safe housing and they're not getting any parenting help with that toddler who's, as toddlers might be, driving them a little bit crazy, or they're not in therapy and they're not, they don't have food in the house, then the treatment's not going to really help a lot. So it's really important to kind of have a wraparound approach and work on all of those issues with them. So finances, medical, mental health, parenting, all of that. Just to talk briefly about one example of an effective program. As I said, I've been with the Parent-Child Assistance Program since 2005 when it started in Shawnee County. PCAP is an evidence-based model that started out of the University of Washington. So it's a free and voluntary program serving Shawnee County parents who are pregnant or have children under 5 who've been identified at risk for abusing substances. We can receive referrals from anybody. Obviously, a lot of those referrals do come from Department for Children and Families if they get a report of substance use and in a substance use environment, and they don't feel like there needs to be removed, but they need services, but also hospitals, treatment centers, people can call themselves. I've gotten calls from people who say, hey, you worked with my cousin and she said you helped her, and now I'm going through something. So our goals are to assist parents in becoming sober, knowledgeable, and committed to providing children with safe and stable environments so the nuclear family can remain intact, to teach parents about child development and teach them additional parenting skills, and to ensure children remain safe from abuse and neglect. So just some of the parts of the program, which can be, incorporated in other programs. We do at least weekly home visits, could be more if needed. We do an individualized service plan with the family, looking at their strengths and their goals. We do developmental and social emotional screenings on all children 5 and under to, make sure if children are having any issues with development or social development, that we can get them connected with services. Just mentoring and coaching. Sometimes sitting with them, filling out the CanCare application so they can get their medical coverage. Having them call the phone to set up the treatment. Sometimes just sitting on the floor and playing with them and the baby, supporting the treatment and recovery process, getting them connected with treatment. We do a parenting assessment. There's a parenting curriculum that we use. So our outcomes are 95% of families maintain safe custody of the children. 100% of families engaged in services receive developmental and social emotional assessments. 100% of those families, the children had a medical home and their needs were met. So they had their immunizations, they had their checkups. And then 100% of families had substance abuse assessments and treatment if recommended. Sorry about the doorbell. UPS just dropped a package off of my house. Sorry. All right, and now I'll turn it over to Mike, and he will talk about the Drug Endangered Children Alliances and developing those.
Well, I think you're just doing that so you can go check your package. I don't think it was actually my turn to take over the slides. No, I'm just kidding.
Well, maybe it's something really good.
So what in the world, from everything that we've talked about, it's like, what do we do next, and what's going on in Kansas, and where are we headed? Before I kind of talk about the steps of developing a DEC program, in your area, I just want to give you a little bit of a quick history. Kansas is the first and only state, well, not the only state, because Massachusetts just completed this, but Kansas was approached about a year and a half ago to see if we were interested in developing what we call a DEC Academy. And what the DEC Academy was or what it is where we went out and found communities that would be interested in starting a DEC program, and we took them all through a what we call a DEC 101 type training. It was a 6-month course where we got together and we talked about, what is DEC, and we talked with National DEC and how to work with developing the coalition and make things stronger, and the DEC approach. And then ideally this was supposed to be done face-to-face, but about the same time we started this, COVID hit, and so we had to take everything to virtual. As you can imagine, it made it a little bit tougher, a little bit more detailed or entailed to pull it off, but it still went well. We ended up with 7 different counties completing this DEC Academy here in Kansas. Those 7 counties, I think that were, and I'll try to remember if I get these right, we set out to get at least 1 DEC Academy in each part of our state. And our part of the prevention world with DECA is we have community support specialists that are located in the different sections of Kansas. So we ended up with Cherokee County out of the southeast corner, Montgomery out of the southeast corner, Elk was another county out of the southeast corner, Coffee was out of the southeast corner. Then we had Pratt from southwest, Douglas in the northeast, and Barton in the northwest. Those were the 7 that went through the actual DEC Academy, but we also have other current DEC alliances that are going across the state. As Jennifer mentioned, Shawnee County is our I want to say I don't want to say our strongest, but it's our longest lasting and one of our most active alliances now. And they've been around since 93 or 94, I believe. And a lot of these got started back when the meth labs were, not that meth is not a problem now, but when the meth labs were more abundant and spread out across the state, there were a lot of different programs. And that's kind of where DEC got its foot in the ground, or footwork was getting involved with these meth, different communities that were dealing with the meth in order to develop these programs to help protect these children. So those are just some of the things. The other counties that we have that are currently up and going is Sedgwick County is up and they're rolling and they're getting started. So if you're interested in getting involved in the Wichita area, Sedgwick County area, we've got an alliance starting up down there. We also have one that's starting or coming back in Reno County, and there's also been interest in getting one started in Butler County. And those are just the ones that we're aware about now. It doesn't mean that we can't start a DEC alliance in your area. So if you are interested in getting a DEC alliance started, go ahead and make sure you contact Jennifer or myself, and we can get you pointed in the right direction. We can get you connected to the Kansas DEC Alliance or at the state level. And also we're looking at working closely with national. One thing that we are working on is we have written a grant for the state of Kansas. It's a 3-year grant that will help develop and spread the word about drug endangered children programs and help create more alliances across the state. So we're hoping to hear by the end of this year that we received the grant. We're not 100% sure that's going to happen. We're hearing some positive things, but we should know by no later than the end of the year if we receive our grant, which then would allow us to take some full-time staff and put them to work starting in helping these alliances get started across the state in order to help these kids. A couple of things to remember when you're going to start a DEC program, and I see I've only got about 5 minutes till questions, so I will hurry up here. Just remember that DEC Alliance is made up of multidisciplinary teams. So people to keep involved if you're looking at reaching out would be prosecutor's office, law enforcement, medical. A lot of folks have gotten fire and EMS folks involved. Anyone that would be in a home that could maybe help identify these high-risk situations. There's even some DEC alliances that have like the utility companies involved. Maybe it's your cable TV installers, things like that. They're all in a home. They're trained to identify different things, some warning signs, and then they take any information that they have and they report it. And it's better safe than sorry, as Jennifer said, is that a lot of times we assume that somebody else will report it. And Jennifer and I were both at the national conference here a couple months ago, and we attended one session that dealt with these were adult children that were raised in drug endangered homes, and they said that was one of the main things was if someone would have asked, and I know I mentioned this before, they would have most likely have told or explained the story of what they were going through at the time. They said a lot of the reason that they didn't say anything is that these children believe that it's their fault that this is happening. They believe that it's their fault they're being raised in these certain situations. They're afraid to tell, they're afraid to, say anything or go and quote tattle on their parents or the adults that are taking care of them because they don't want to get in trouble. So a lot of times it's just one of us reaching out to go ahead and reach out to these kids in order to help them out. A couple things are once you get going is distribute your draft protocols and kind of look at what organization can do what in the process of how we're going to handle if we come across these drug endangered children. You need to determine the training needs for each organization. They may be different, and also you can seek out additional training from outside sources. So the one thing that we are looking at bringing to Kansas is what we call a DEC 101 training of trainers, to where we'll bring in national folks to do a DEC 101 to educate us all, and then we can go out and train others on this. And the more awareness that we get out there, the better off that we are. Real quick on Shawnee County, they began in 2004. I mentioned that they were meth lab specific, and that was in 2006. The core agencies did protocols in 2008, and then they were reviewed and signed for updates every several years. Shawnee County, they have regular meetings every other month. Their meetings are held at 7:30 in the morning, and they also provide community trainings for education. They have tip cards and other educational materials that they make available, and then a lot of public awareness activities. We actually worked with Shawnee County on what we call DEC Awareness Month earlier this year, where we came out of our DEC conference. We do have a Drug Endangered Children conference each year. It's the end of March. And then we went into what we called Awareness Month in April with DEC Awareness Day. I think it was April 28th or the end of last Wednesday in April of this year. And I believe it's at the end of April again this year. So we are looking at putting some stuff together again to raise awareness there. If you want more information on the different roles, there is a free course out there on KS Train. It's the Kansas DEC, the role of professionals in identifying drug endangered children. There's the course ID. It is certificate of 1 hour of contact, and it actually has a lot of videos and real life scenarios that are out there. This is just an example of what we call like a rat card or a tip sheet. Talks about alcohol and other drugs during pregnancy. These are put out. This one is, these are from the actual Shawnee County DEC Alliance. This one's on methamphetamine. I think we have another one here coming up on, this is one about, is your partner a threat to your child, which talks about, is there a possibility that the partner, the person that you're with, could be endangering the children or possibly be in a situation or could lead to drug endangered children. So there's information about that.
Yeah, I was just going to say real quick, the tip cards that we just showed you, and for the substances, we have methamphetamine, cocaine, marijuana, prescription drugs, nicotine, alcohol, marijuana. And so we have digital versions of those. So I'm always happy to send like the digital copy to anybody in the state who wants those, and you can put your own information on it. Just, it's a quick handout to give to parents or to people who might need that. So just wanted to.
Thank you, Jennifer. We also have what we call a DEC toolkit. Well, real quick, just a couple resources that we've used, and just for you, there's the Kansas Alliance. That's the actual state drug endangered children alliance. There's Shawnee County's information, National Institute on Drug Abuse, Center of Drug Abuse and Child Welfare. We also have here's the National Alliance, which is the DEC National DEC organization. Not only do they have an active website, but they also have a very active Facebook page. So if you're a Facebook user, you can jump on there and look for the National Drug Endangered Children Facebook page. And they actually have featured lately, Pratt County had a really nice article in the paper about their efforts, and it just made the national DEC Facebook page. So it's out there if you'd like to read more about that. Just some final thoughts before we take some quick questions, and we're going as quickly as we can here, but remember, the best interest of the child should be at the forefront of every interaction. It's very important that we intervene early. We started this off with talking about pregnancy and in utero, and also the how much that can increase the effects or the risks of these children. You may be the only one that reaches out to this child, so make sure that you can do your part, and when in doubt, ask for help and approach the situation. Better to be protective of these children than not. And just a couple things to remember here on that next slide is that with one of us is naturally, these are some things. It's gone with no food, take care of a babysitter. These are all different things that points out that one of these children in there are possibly or could have been raised in a drug endangered children environment. So, okay. So with that, I'm sorry we ran a little bit longer. Here's our contact information, but if we have time, we could take a few questions. We know it's close to 2 o'clock. Jennifer, did you have anything else?
Nope, I don't think so. Just, yeah, if anybody has any questions, or like I said, I know we're getting close to time, but yeah, Mike and I can certainly stay on too for any additional questions if we run out of time.
There's a few questions in the chat. First, will these slides be available to the participants? Will they be uploaded to the platform?
I have not done that. Yes, we can certainly do that. Yeah, right after this ends so that they can be
Okay,
on the website. Absolutely.
That'd be great. And there's quite a bit of chat about removing children from the home. So I'm not sure if anybody wants to comment on that, but there's quite a few things mentioned on that. And Joy would like if you could show the KS Trains information again.
Sure, let me get back up to that.
And Denise would also like the digital cards, please.
Yeah, if you just want to, yeah, message me or put your email or email me. Like I said, my email was on there. Then you have to send me your information. I'd be happy to send those out to you.
Okay, does anybody want to unmute themselves and ask some questions in the last few minutes here?
Nancy, you don't happen to have real quick the link to the toolkit, the Drug Endangered Children toolkit, do you?
Get it in a jiffy, hang on.
I'm looking real fast, and I figured you might be quicker than I am getting it into the chat.
Yep, I've got it, hang on.
Sorry, and I put the slide back to our emails just so you have those if you need it. So hopefully you got the information on the Kansas train, but just wanted to end it with our emails because of course you can always email either of us directly for anything further.
There you go. Well, thank you, Jennifer and Mike. That was a great presentation. You very successfully crammed in a lot of information in 1 hour. I'm impressed.
We spoke fast. Hopefully not too fast for everybody, but I just want to thank everybody who attended, and yes, thank you for allowing us to share this information, which yeah means a lot to Mike and myself both. This is definitely a very important issue for us.
If you're interested in, like we said, getting an alliance started in your area or need more information about how to do that, or if there's one going on, just contact us and we'll help you out.
Okay, we've got 1 more minute left. Let's stay on in case anybody has
Sure.
something to add. Thank you all for attending. It's a really good session. Would you like to stay on for a few more minutes just in case, or?
Yeah, that's fine with me. Yeah.
Okay.
So when you say the recording will be available like an hour afterwards, available where?
I believe it will be on the platform. You could go back to the agenda and click on your session, and it should be there. You should be able to download it.
Okay, all right.
Nancy, do you know what I need to do to upload the presentation onto the website?
I do not.
Okay. I was like, sure, I'll be happy to do that. I'm like, yeah, how do I do that?
Yeah, let's see
I will
if we
be
can
happy to
figure
do
it out.
that.
Okay, so if you go to the session page and you click on files, you can add a new file from there.
Okay.
I think, I'm not 100% sure, but do they have to be PDF in order to upload them? We have to convert them? I think we do. For some
Right.
reason, I remember hearing that or reading that.
It may be. Have to do that with Adobe. Yeah, I need to jump off because I have to hop on to my next session. Do you
Okay.
guys need anything else from me?
Nope,
Nope.
I think we're good if you want to go ahead and shut her down.
Yep,
Okay.
sounds good. Thank you.
Thanks, Nancy.